Welcome back to IPHCA's Health Talks podcast. On this podcast, we highlight incredible individuals who advance community healthcare, advocacy, and public health while striving to improve patient care. Where we're listening in on a conversation between Ollie Idowu, CEO of IPHCA, Reverend Pastor Brooks, CEO of Lawndale Christian Health Center, and Ken Burnett, CEO of Christian Community Health Center. In part one of our Black History Month series, we heard them share their journeys, their challenges, and what gives them hope for the future of healthcare. In part two, we'll continue exploring how these stories point toward meaningful change.
I can share something I'm very excited about. We're starting soaring classes at our health center for our patients, and our employees are also excited to participate as well. Why is that so significant for me? It's an opportunity, again, for fellowship and the way that the instructor is going to engage the individuals. And they're novice to sewing, teaching them how to sew. And it's just empowerment, but it's also therapeutic. And it also can be a great resource. It's a cost savings because you're learning how to have accomplishment of putting and making, a garment or an outfit. I'm very excited about that. Something else that really I enjoyed a great deal was last year we did a Black Men's Health Summit led by Black men talking to Black men in the community at one of the local colleges. And it was just so profound for me and uplifting for me to see so many men interfacing with each other and supporting each other and caring for each other and talking about trauma and entrepreneurship, talking about healthcare and seeing the professionals and seeing college students and seeing young people sitting in a room and engaging in that conversation. It meant more to me probably than it meant to them because it would just love to be in that room to see them gathering and enjoying each other and communicating and leaving that room feeling encouraged and looking forward to the next gathering. To me, that's exciting. Those are things that I enjoy. You see a difference made in somebody's life with something very simplistic, because that's simplistic. That's just gathering people together. I just look for, those are things I enjoy. Healthcare, providing care, yes, but looking at other opportunities to get individuals to come in just to feel, again, empowered and encouraged and a sense of accomplishment. I think that's important. And that's some of the programs that we've started.
Yeah, I got a list of stuff that I'm really excited about being a part of that we're doing here. Of course, we know about integrated behavioral health. It makes a difference. And when I talk about these programs, I'm talking about myself personally, and I'm talking about my family and my community members. Another is the hypertension, the remote monitoring, right? My father, he had 14 siblings, and out of all 14 of them had a struggle with hypertension. To have this innovative way, remote monitoring, DPP, diabetes prevention. My mom suffered big time with diabetes. So to be engaged in an effort to help those kind of patients makes a difference. Our mobile health, one of my values again is proximity, right? Maybe patients can't come to us, but how do we get to them, right? So having a team of those who are going to the shelters where the unhoused are and being there, because even in my community, I know homelessness, those experiencing homelessness are growing, unfortunately. The other thing is recovery community. And this is dear to my heart because I'll pause right here. My own brother, Glenn, when I was younger, he passed away. He was addicted to heroin. And now that I get to lead an organization where we could offer medicated assisted treatment and recovery community for brothers and sisters, it just makes me smile because every time I see one, especially as they're able to live life normally because of the medication, I say, man, that could be my brother, And I guess that's why, like, having brothers like Ollie and Ken in my life, it matters to me. I actually, there's some transference, right? Because my biological brother is gone, but I think God has given me other brothers in my life that I can talk with. And, as we all know, telehealth, having access to just, no matter where you are, you can access your doctor. That makes all the difference in the world. And the final thing I'll lift up is PACE. We have a program for all-inclusive care of the elderly. Man, both my mom and dad have gone on, but I know how life was so challenging near the end of their lives, and to be able to care for our most vulnerable seniors. Oh my goodness. So all the things I just listed or just named, these are programs that have impacted my family personally.
So it's probably a little different for me, right? Just because of nature. But I want to just lift up, I know how I got here, but when you are, I moved back to the United States when I was 17, and I knew right away what I wanted to do, right? I wanted to be a doctor. I knew I was going to be in healthcare. I never worried about how I was going to get there, even in spite of all the things I knew. But I want to call out some people. So this is why, and that program still exists. So I met this biology professor at City College, Dr. Betty Richards was her name, and I took a biology class, and she just took a liking to me because I was more of a nerd. And she gave me this guy who was at Illinois Institute of Technology, Dr. Reginald Jones, who started this program called CHAMPS. So it's a Chicago area minorities program for people who wanted to participate in health professions. And my first year in the program, I was placed at Midwestern University, the Osteopathic Medical School, Downers Grove. I was doing research in biochemistry, freshman, from City College of Chicago, right? Second year, I was placed on the South Side, Trinity Hospital, working there in the quality assurance office. So I'm talking some kid that just moved back to the States as a sophomore. For 4 years, I never worried about what I was going to do in the summer. That program helped me whole. Paid for me to take my medical school exam. I did. In fact, when I was considering whether I was going to go to grad school and med school, I can remember calling Dr. Jones, and he was like, son, if you want to be a PA, if you want to be a pharmacist, whatever you want to be, in health professions, I got you. And that program in this area has seen a lot of physicians, not just physicians, dentists, pharmacists. I have mentors who were in the program before I was, who were bigwigs today. So being able to still talk about that program, see it a few years ago, they went to the legislature to get some money to keep that program still going. It's morphed into different things now. They have a part of it that focuses on kids doing STEM, but those kind of things, giving real opportunities for people, supporting those kind of programs is passionate to me. I still talk to some of those folks. A lot of them are physicians. We actually just talk about what can we do. And statistically, over the last 3 years, the number of underrepresented minorities in health professions has actually dwindled. And we need to bring them. So we talk about providers in our communities, but it matters when providers look like the people that, And so bringing that back and supporting that's been a passion of mine, and just making sure, because that's how I survived. That's how I got to where I'm at. But beyond that, there are other things that I would say, talk about this whole thing about being entrepreneurial, right? And there are opportunities even in our industry in healthcare. And so partnering with businesses that really get what it means to uplift the community, businesses that really are developed, right? With that kind of mindset, we're talking now, everyone talks about artificial intelligence, right? But even when you talk about AI, is it being diverse enough? Are the inputs going into those components? Do they represent the communities that exist today? So I'm always looking for partnerships. And as an association, could we partner with businesses that are minority-led that really want to have an impact in the communities we serve. And so, and you know, in the last 4 years since I've been back with the association, we have champion partners like that who really organically care about those populations. And so I'm proud of that. It's not the only way we look at things, but being able to give a voice to those partners matters. And then, you know, for me, I get to ride the coattails. I was at Ken's Men's Summit. Phenomenal, great event. I was happy to be just to see all those young men, and you know, I learned things, right? And from him, it's like, yeah, I want to give young people, I don't care where they are, an opportunity to see leaders, to see the possibility. I'm just always amazed about learning. So I have to say I'm riding their coattails on some of these things, but it's great.
I believe if the community is not well, we're not well. If I'm not well, then the community is not well. What affects one directly affects us all indirectly, right? Martin Luther King. So health is community. So therefore, if health is community, we have to do our part, of course, in the exam room, right? But that's only 20% of a person's overall wellness. The other stuff comes from those other social determinants of health that we don't necessarily do, right? But we have partners in the community that specialize in those areas. Safety is one, right? Violence prevention. We have organizations in our community that have violence interrupters on the ground every day. So for health, then, if we're going to really be a health center, we got to say, okay, what do we do well, and who do we need to partner with in our community so that they can continue doing their work as well? Because it takes all of us. I like the saying, we are better together. It takes all of us. So partnerships are crucial to community development. Partnerships are crucial to health care, right? Because it all links together. So that's how I think about partnership and collaboration. We cannot do this work alone. That's healthcare to me.
I think we started off talking about the importance of Black history. And we talked about celebrating, you know, our ancestors, you know, African Americans who helped build America. Their struggles here. So it's in our DNA to be hopeful and to overcome. Yeah. So what we're dealing with today, we can overcome it because we're built for this. We are prepared for this. We were introduced to this. We understand the importance of this. It's ingrained in us because we know who we are. It's a core fabric of us. We live it. We speak it. The changes that we're seeing today is only preparing us for tomorrow. Because think about it. This Black history, our ancestors did not give up. They became stronger and they had faith. And I believe, I was in Philadelphia a couple of years ago and I saw this signage. It said, believe, begin, become. I think every day that resonates with me. We always beginning something to become it. But we always got to believe. And we have that faith. So I'm encouraging. And you're right. We lead by example. I'm encouraged with the leaders that we have in the room and those that we interface with outside of this room. We're going to be stronger together. We're going to collaborate more. We're going to impact the community in a favorable way. We're going to give opportunities to others, be a trailblazer for them because someone gave us the same opportunity. And we're going to motivate and encourage them to stand on our shoulders because we're standing on someone else's shoulders. So today I'm just as hopeful as I was 5 years ago. So I'm happy to be here with my brothers and working with them because true collaboration and partnership, this partnership that we have with each other, with each fellow colleague, but also the same partnership that we have with the community, with our patients. That's what a community health center is built on, collaboration, partnership. and engaging each other. We motivate our patients to educate them about the health and well-being. So I'm here today feeling very encouraged today.
That was interesting because as you were talking, I started thinking about Black history as a time when we celebrate a people. And I say that intentionally. I highlight people. We celebrate a people. There are moments when we celebrate a person, but overall we're celebrating a people. And one thing I know about Black history is that all the movements that went forth, it was about doing it together. It was a people, right? It was a people. You don't get stronger by yourself, and everybody needs a spotter. You know, if you're gonna get stronger, you gotta have a spotter. Hey, bro, you know, that's why we're in this room together. Hey, bro, come spot me. Man, I'm struggling with this right now. I got you. And then because you have a spotter, you can take that heavy weight and you can handle it a little bit better. And you have a little more confidence. Why? Because you got a spotter. And that's what it's about. It's about doing it, lifting the weight together. It's about us joining arms, not pointing fingers, but linking arms and saying, we in this together. And we got to get through it together.
My thing right now are quotes and understanding them, and they're always situational. So, you know, we're talking about resiliency, and I can remember this poem by Maya Angelou about I Rise. Man, read it, say it over and over and over again if you want an affirmation as a people, Black History Month. Can't go wrong with that. The warrior in me will still always go with the Churchill. You know, it's not the critic who counts, not the man who points out how strong a man stumbles or where the doer of deeds could have done better. The credit belongs to the man who's actually in the arena, whose face is marred by dust and sweat and blood, who strikes valiantly, who errs, who comes short again and again, because there's no effort without error and shortcoming. Boom.
If you enjoyed today's episode, don't forget to like and subscribe on your preferred platform. It helps us reach more listeners and create more content like this.